Doctors and nurses, what were the creepiest last words you heard from a patient right before they died? Story 1. I was a hospice nurse for many years. Super gratifying job for a nurse, surprisingly. As a regular nurse, you are rarely offered thanks. Hospice nursing is an island unto itself. Mostly peaceful, lots of times sad, often a blessing. This is sad, but also creepy. And I wouldn't believe it if I hadn't seen it. Had a 20-year-old kid, gang member, who was dying of primary liver cancer. Super unusual, aggressive, and terminal. He was angry at the universe. His family was there to comfort him, but he literally spit in their faces. Every ounce of energy he had left was angry and mean and ugly. His mom would beg him to lighten up and accept Jesus into his heart. He would swing at her and tell her to F herself. The family remained bedside in hopes that he would chill out at the end. His last days, hours, moments, he was angry. The family called me into the room and told me they thought he was going. He wasn't responding, Cheyne-Stokes breaths, eyes glossy and skin cold. The end was imminent. His lovely mother, in her dearest attempt, whispered to him to go towards the light, to her Jesus. With his dying breath, he opened his eyes, looked at her, and said, F your Jesus. A second or two later, he slowly turned his head to the left and got the most horrific look on his face, as if he was looking at something we couldn't see, and horrified, like in a bad movie. His face contorted and he screamed with his last breath, eyes wide, oh crap, oh no. Then made a guttural noise and promptly fell back into the bed and died. Every family member was shaking and too frightened to speak, and I left the room and took 2 days off. I don't care if I never find out what he saw. Here's a comment from under the post. Well, he was angry at the idea of Jesus, right? So maybe Jesus showed up and took him to heaven, and now he's up there sitting in a corner scowling. My grandma died in 1989. My grandfather, Bob, died around 1965. She never remarried, never dated, but she did have a great life. Look, I don't think it was right for the mom to try and force Jesus on the kid, but I also don't think it was right of him to yell at her so much. They both were probably grappling with his death, so I can understand it. What I can't understand is why he reacted so gutturally. I hope he and his family were able to get some peace, though. Story 2. I don't care that I'm not a nurse, but this was said by my dad to the nurse, so close enough. Backstory, Dad had MS. He'd had it since he was 18. Diagnosed at 20, married my mom at 24, had me at 29, died 15 days short of 45. 6 months before that, he was put on hospice. He and Mom were discussing funeral arrangements, and my mom jokingly said, You know, Tim, the best thing you could do would be to die on a Wednesday. That way we can have the body prepared on Thursday, the viewing on Friday, and the memorial on Saturday, so more people could come. The morning we got the call that it was time, my mom, 2 sisters, and I were about 5 minutes too late. After we said our goodbyes, the nurse pulled my mom aside and asked if that day had any significance. It's not even 6 a.m. yet, so Mom doesn't even know what day it is, much less if it's important. The nurse tells her it's May 21st. No, nothing comes to mind. The nurse told her that the previous day he kept asking what day it was, and they tell him it was the 20th. He'd look irritated but accept it. That morning he asked what day it was, and they said it's Wednesday, May 21st. He smiled, squeezed his favorite nurse's hand, and was gone almost immediately. It was Memorial Day weekend, and we did just as he and Mom had planned. And despite many friends being out of town for the holiday, we had over 250 people show up at the memorial service, overflowing the tiny church more than it had ever been filled. To his dying day, he was trying to make things easier to our family. I miss him. Here's a comment from under the post. Hey, out of this whole thread, this one got me the most. People who think of others in their last moments are really the example we should all live up to. Thanks for sharing. Hugs for you. I feel like it's just like a dad to try and look out for his family one last time. And on such a potentially sad or scary thread, it was nice to have a story with a relatively happy ending. It seems like Opie's dad was truly loved, and I'm sure he's happy to know so many people came out to celebrate his life and legacy. Story 3. I'm working on my mother's eulogy for tomorrow's week. I'm gonna go into detail for anyone that is smoking because I think it's something you should reconsider. My mom was diagnosed with terminal lung and pancreatic cancer. Mass had developed around her vocal cords and made it hard for her to speak. She smoked all of her life and it finally caught up with her. It attacked her quickly, from the time she was diagnosed to the time she passed away. It was less than 2 weeks. First, she lost her voice. Then she had difficulty breathing, became weak. She couldn't walk too far. Then she could only walk a little, then nothing at all. She had trouble eating. The night she died, I let her smoke her cigarette. Doctors said it didn't matter anymore. And my sister and I took Mom into her bed, and I knew, as did my sister, it was the last time. We spent a few hours with her, holding her, and I got up, lost it a bit, and my mom said, "Don't be sad," loudly with all her might. I was fortunate to be with my mother at that time, and she was due to have hospice that Monday, but she did not make it. Lung cancer kills quickly. I hope none of you have to deal with that. Consider it that next cigarette. It's just a matter of time. Well, enough preaching. And here's a comment from under the post. I'm sorry for your loss. I actually used to work as a care nurse for the elderly, and I would see a lot of clients with a similar story. Smoked when they were younger because they didn't know the consequences, and now they get diagnosed and have their life change within a few months. I would never tell anyone what to do, but I know from my own experiences that smoking is always something to reconsider before you start. Story 4. I actually have 3 that stick out in my mind. An 83-year-old woman said, "My mom's here. Are we going?" She died a few minutes later. Another old lady said, "I think I'm gonna die today." We took vitals. Everything seemed fine. She was stable. She had a heart attack a couple hours later. Not her last words, but the last she ever said to me. The last one is definitely the creepiest. A nice old lady who told my CNA she wanted her to wear all white. When asked why, she said, "The man in black is here." She looked in the corner of the room. The CNA looked, but there was no one there. That's when I came into the room. We asked her to describe what she was seeing, and she said, "He's in all black, and he's got a top hat on." Then she whispered, "And his eyes are red," while her eyes moved across the room directly behind the CNA, like she was watching him move closer to us. She died later that night, but it was unexpected. That room creeped me out for a long time after that. Here's a comment under the post. Sounds like she was talking about the Hat Man. That is creepy as frick. Story 5. I'm a nurse and was previously working at an assisted living community in the dementia and Alzheimer's unit. My very favorite patient had been declining pretty steadily, so I was checking on him very frequently. We would have long chats and joke around with each other, but in the last 2 weeks of his life, he stopped talking completely and didn't really acknowledge conversation directed at him at all. I finished my medication rounds for the evening and went to see him before I left. I told him I was leaving for the night and that I'd see him the following day, and he looked me in the eyes and smiled so genuinely and said, "You look like an angel." I thought it was so sweet because he had not seemed lucid in weeks. He died the next morning. It really messed with me. Here's a comment. Wow, that put a tear in my eye, and I'm not the kind of guy to have that happen to me. You obviously had a very positive effect on the final weeks of that man's life. Hold your head up high. Story 6. I found one of my comfort measure only patients standing at the side of his bed. It surprised me because he had been mostly unresponsive during my shift. I helped him back into bed and he asked me why all these people were in his room. He suddenly became quiet again, and I noticed he wasn't breathing. He was a DNR, do not resuscitate, so there wasn't anything to do to try to bring him back. Looking back, he may have been talking about me and the CNA that was helping him get back into bed, but who knows what or who he was seeing in the last minutes of his life. Still creeps me out a little when I think about it. Here's a comment. My father-in-law sat at his mother's side for days as she was dying. She was in and out of it and spent a lot of time in conversation with her parents and siblings, who were all long dead. One of the last intelligible things she said was, "Leave the gate open, Rodney. I'm coming." I think it's always so interesting how people will see their past loved ones sometimes right before they die. I've heard that scientists claims it's due to the brain's natural reaction to try and lessen the pain for us, but I always wonder if there's something more supernatural going on. Story 7. I'm a hospital chaplain. When I was a CPE intern, a greenhorn, I went to see a patient in the ICU who had 10 to 12 oranges on her table. We talked about oranges for about 20 minutes, and then she said, "Something's going to happen." I went to check on her the next day, and the nurse mentioned that she had passed the previous night. I asked if anyone else talked with her, and she said no. So the last conversation she had was about oranges with me. Kinda wish we talked about something else. However, the nurse said that that was a worthy conversation that the patient wanted to talk about. It made me feel better. Here's a comment. Because oranges are foreshadowing, someone is gonna die. Story 8. Grandfather died this year at 86. He was in Nashville in a hospital for pneumonia. I was working and was going to go down there the next day to see him. My mother called me and said he was passing soon, and if I wanted to talk to him. I said yes, and this was the conversation verbatim. Me. Hey, Papa, it's Marky. How's it going? Grandfather. I'm sick. Can you hang on a few more hours and I'll be there? Nope, I'm out of here. I love you. All right. He died before the phone hung up. Really bothered me with how accepting he was of his own death. I think about it every day. Here's a comment that's pretty funny. You. I love you. Him. All right. Nice. Story 9. Not a doctor or nurse, but my grandfather was on hospice care at home, and for 2 days he told us that he had to go with the little red-haired girl. We didn't know what he was talking about. When he died, we cleaned him up and called the hospice nurse on duty, who came right over. I happened to be the one to answer the door, and there she stood, 5'2" or so, with gorgeous blue eyes and the most beautiful red hair you've ever seen. I couldn't even manage hello, but my grandmother looked around me and said very cheerfully, "Please come in. He's been waiting for you." Here's a comment. Sounds like the opening of some kind of feel-good ghost story. Story 10. The DNR patient was in comfort care, was on a high dose of morphine and hallucinating. She would alternate between grasping for things not there and trying to climb out of bed. She was too unsteady to walk, so my job was to sit in the room and make sure she was safe. She tried to get up and I went to ask her what she needed. She grabbed my arm and pulled me down towards her face and said very angrily, "Kill me." That one fricked with me for a while. Here's a comment from under the post relating to the story. I was in the hospital for a week on morphine. After a while, that stuff really starts to mess with you. Okay, if anyone has been on morphine before, can you let me know if this was true for you too? Most of the people I've seen been on morphine seem to be a lot more chilled out than the woman in the story, but it would be cool to hear if anyone else had a similar experience. Story 11. Get home safe, little one. It wasn't what he said. He said the same thing to me anytime I had him as a patient for the evening. It was how he said it. He gave me this look and paused like he knew. The DNRs, in my experience, always know when it's time. It's creepy. Here's a comment. Relieved. They're relieved when it comes. Most of my patients were older and usually happy that they might see their friends and family again. Relieved that the pain will be gone and that they won't be lonely ever again. Speaking of, if you have older relatives that aren't buttholes, please visit them. They miss you. Story 12. Cardiac ICU. Had a gentleman who was DNR on comfort care. He was demented and was cursing like a sailor. He seemed to have moments of clarity and would ask to see his brothers, who were both passed. After a particularly worrisome heart rhythm, he went back into a sinus tachycardia and looked me in my eyes and said, "Hey, what's your name?" "Kabak." "What do you do here?" "I'm a nurse." After this, he went quiet for some time. Then he said, "Frick you." And then he died about 20 minutes later. Here's a comment. I can only imagine what was going through his mind as he passed. Nailed it. Yeah, this comment got it right. I definitely feel like this guy had been planning to go out like that, which is honestly pretty funny. Story 13. I was in the army in Pakistan for humanitarian support after an earthquake. There was a very serious school bus crash when a road gave way and a dozen kids were killed. The first kid that we took off in the ambulance and put on the stretcher to carry into our triage tent said, more like screamed, something in Urdu. When we got there, the doc asked the translator what he said. It was, "The spiders are eating Papa." We all just looked at each other for a second, then just proceeded with triage. Here's a comment from under the post. Honestly, triage is easier when you don't speak a mutually intelligible language. Story 14. Nurse here. Had a patient come into the ER with shortness of breath. He started deteriorating in the ER and then quite rapidly on the transport up the ICU. We got him wheeled into his room, replaced the ER lines and tubes with our own, and transferred him from the transport stretcher to his ICU bed. He actually did most of the transfer himself. He didn't say anything, but just before he died, he pleasantly adjusted his own pillow, laid his head down, and then his eyes went blank. This man just made himself comfortable before laying down to die. Story 15. I've commented this somewhere before, but it stayed with me. I'm an RN, and while I was a student, I was caring for a lady who had end-stage renal failure, had a DNAR, and was shutting down. We were having a little chat. Well, I was chatting away while helping her put on some lotion. When she stopped, looked over my shoulder and said, "Bill's here, love. I've gotta go," and swiftly stopped breathing, read her old notes, and Bill was her deceased husband. What a way to go. Story 16. Not a hospital story, but according to my family, My great-grandfather was unresponsive his final few days, but suddenly sat bolt upright in his bed and then had a huge smile and raised his hands out as if he was greeting someone. Then he fell back and died. And here's a comment. It was the same with my brother, but he didn't sit up. He just smiled, lifted his hands up and out, and died. These jolts of energy are absolutely terrifying. A, because someone just shoots up after being sedentary for a while. And B, because you typically know they're gonna pass very soon. Story 17. I worked a bank shift in A&E a few months ago. A young man was in a horrible car crash. His face was covered in blood and had a compound fracture of his clavicle, but conscious. He was screaming, "Don't tell me she's dead. Where is she?" before succumbing to his injuries an hour later. His girlfriend had died instantly in the crash. Here's a comment. Aw man, he must have been in so much pain, but he's panicking about her. It would have been so rough. Story 18. My dad fell into unconsciousness around noon. We managed to get him into bed and he responded with a hand squeeze. When I said, "I loved you," we watched and waited the rest of the day. Around 3 a.m., his breathing changed, and as his breathing became more and more labored, he bolted upright, eyes wide open, looked at his wife, my sister, then me, smiled, exhaled, and died. Story 19. Checked in on a patient before the end of my shift, and she was in good spirits and had been joking with me the whole time. Her condition was tenuous, new trach, but she had been positive throughout. I asked how she was doing, and she replied by singing, "The old gray mare ain't what she used to be," and wished me a good night. I came in the next morning, and she had coded and died overnight. At least OP was able to get a little more time in with the lady and bring her a little joy before she passed. Story 20. Not a nurse, not a doctor, but I'm a Prenton's funeral director. We went to a nursing home on a removal, and as we were walking down the hall, one of the patients got antsy and opened the door to his room and saw us walking with a stretcher. "I'll see you next week, boys." And guess who we had to pick up the next week? Here's a comment. It never ceases to amaze and entertain me how Gallows humor makes it into our lives. Story 21. I work in a cardiac ICU. We had a patient who had a pulmonary artery rupture, a rare but known complication of Swan-Ganz catheter. One minute he was joking around with us, and the next bright red blood was spewing out of his mouth. His last words before he died were, "Why is this happening to me?" It still haunts me years later. I can't imagine how awful that was. Story 22. My first hospice case. She was on morphine and started mock smoking. She looked at me, took my hand, and said, "Please," in the most pleading voice I've ever heard. I sat with her body until the coroner arrived. She has no friends or family. Only her lawyer showed up. I've only done one hospice case since. That's so sad. She must have been so lonely. Story 23. My grandfather's brother died exactly 6 hours after my grandfather, and just minutes before he died. He said, "I'm gonna see you again, brother." He didn't know at the time that my granddad, his brother, had died. The family were gonna tell him the next morning because he was having a bad day. Yep, the day doesn't get much worse than that. Story 24. When she was dying, she yelled, "Bob, Bob, here I come. Oh, honey, I've missed you so much." We always joked that we were glad she didn't yell, "Bob, who the heck is that?" "Elizabeth, I'm coming to join you, honey." Sorry, but this came right to mind. Story 25. Last year, my grandfather started desperately pleading for his life with his German captors from World War II. The doctor present was smart and said in German, "You are free, Herr Charakter. You are free." And then he died. Here's a comment. That was nice from the doctor. Story 26. Back when I was a can, this one resident fell off a bike for exercise and PT and seized. They came to and just became lucid and said, "I think I'm dying," but everyone in the room assured her that wasn't going to happen. She seized up and was dead within minutes. Story 27. Intubated patient wrote on a clipboard, "If this hurts, I'll get you," just before the surgeon pulled out the PT's chest tube post-open heart surgery. The tube ripped one of the coronary grafts, and he bled out in about 5 seconds. Story 28. My mom was watching over my great-grandfather in the hospital. He'd been unresponsive for a day or so, when he said, "It's about dang time you got here. I've been waiting." And then he died. Story 29. Not a doctor, but I overheard an old lady whisper this to her old husband, dying of kidney problems. "You are gonna beat this. You got away with murder. This is nothing."
Please leave your story in the comments. I would love to make a video on them in the future. Also, don't forget to like and subscribe.